Hello, I'm Josh from Dream Body Clinic. We're here with Dr. Jacoby, author of Sugar Crush.
Not Sugar Crack, Sugar Crush.
Yeah. And people think it's like crack, but I get all addicted.
Yeah, they're all addicted to sugar because it tastes great.
Yeah.
But it causes a lot of damage for sure.
Yeah.
And I'm so impressed with your new clinic here. I've seen your clinic before and brought patients here, sent patients here. They're all very happy, by the way. But what you've done here is absolutely game changer. In your laboratory that we just toured, when that's done, that'll really make a big difference.
I think so, yeah. We want to document, we want to be as transparent as possible. I think that's a big problem in this industry with the stem cells, that I don't know, it feels like nobody wants to really show anyone what's going on. So we're trying to open that up and just explain it as well as we can.
Yeah, and we're talking about stem cells, what they are, how they work. Well, we're really not inventing anything. I was telling you about Don Johansen. He was the discoverer of Lucy, our first primate, if you believe that story. She was 3.2 million years ago, first primate, and now the U.S. has said that amniotic tissue, which is not stem cells, but is lots of healing factors in there, they just declared that a drug. So I guess Lucy is a drug dealer.
Yeah.
Yeah. So, but now we're left with very little options in the United States. We can use umbilical tissue. That's what you use here. And we're all using the same type of technology throughout the world, but the laws are different in Mexico and than they are in the United States. So why don't you tell our audience what you do down here, what the main things you treat?
Yeah, so our main thing is we use mesenchymal stem cells, and our big difference here versus the US is that we can culture the cells. Like you told me, you're limited to minimal manipulation. We aren't limited to that, so we expand to the third round, and that just gives us a much higher number. It's the mesenchymal stem cell works the same regardless. We just want more of them there to do more healing.
Makes sense, doesn't it?
Yeah, and it's the way that you're supposed to heal, and that's what we want people to understand. Like you said with Lucy, being a drug dealer, we're not reinventing the wheel. Like, your body's meant to heal like this. We run into issues. We hit bone maturity. We lose 90% of our blood vessels, and it turns out that's where they live, right? It's pericytes.
Exactly. It's just bringing new blood supply to the injured part, and they work through miraculous mechanisms, a lot of which we don't know how they actually work, but we don't know a lot of things about a lot of things. And we know they work. Like planes fly, TVs work, and stem cells work, and they've always worked. But this is a absolutely remarkable center. What you've done here is just, not that your other center was beautiful. Now this is on steroids.
Yeah, that was kind of the goal. Help more people, be able to have the lab here on site, just all right there. And we're treating a lot of things, like you'd asked, I'd say knees are the most common, then backs, and then autoimmune diseases and organ type diseases. A lot of heart failure, a lot of kidney failure. So it's kind of it sounds too good to be true. It's too many, you just fix everything. It's like, no. Well, there's a pretty wide range.
It's a pretty wide range. I always kiddingly say, stem cells don't give a rat's ass what you call your itis. Meaning that these names that we assign to a disease, from MS, autism, Alzheimer's, these are observations. They're not diseases. They're inflammation of the tissue, and we get into epigenetics. In my book, Sugar Crush, we kind of talked about it, but the new book, which is called Unglued, is really going to feature stem cells in all its varieties, how we can get unglued as a society. It's not really that complicated, but it is complex for sure. And then there's a lot of laws that we have to deal with, both in Mexico and the United States. I was recently in Panama, and there's a great clinic there as well. There's great stem cell clinics all over the world. But my patients in the U.S. want to know where they can come. Is it safe? Is it effective? Are the accommodations good? Well, Mexico is a beautiful, beautiful country and a beautiful airport. Very easy to get to. Like from Phoenix, it's only 2 hours. Houston is only 2 hours and a little bit. So you're really the suburb of Scottsdale, where I live.
Yeah, it could take you that long to drive to Phoenix to Scottsdale.
It does. It does. To drive around, actually, metropolitan area of Phoenix, there was a builder just doing a story on that, and it took him 10 days to go around the perimeter to tell the story. That's how big so it's 2 hours here, it's 10 hours to drive around there.
Oh, man.
Yeah. It's a big place.
Yeah. Well, and my wife, I took her there for the first time ever last year, and she'd never been in dry heat. It was in the summer. And she's like, it's 9 o'clock at night. She's like, it's like when you're too close to a bonfire, but you can't get away.
That's a good way to put it. It is. We say we get used to it. Well, we have to.
Yeah.
But it is warm, but most of the year it's beautiful, just like it is here. It's a little warm today here.
Yeah.
But a little higher humidity than I'm used to. Yeah. But I love the beach, and you certainly have beautiful beaches here.
Yeah.
And the other thing, the people are so laid back here. They're so happy.
It's a very laid back, happy environment.
But the food is great.
That's why they're so happy.
The
food and the weather. I mean, it's tough to go wrong here.
It really is.
And I've been here a little over 15 years, and like I was just telling you, I've never seen a violent crime. It's super safe. Like, there aren't bad neighborhoods because there's no drug dealing here. It's not allowed. It will not fly. So there's no bad neighborhoods or anything like that. It's an incredibly safe place. It's really close to the U.S. and, we get a little bit of everything here.
We were talking about the food supply, and Mexico is kind of upset with the food that U.S. is sending Mexico, and so I was talking about the cartels. U.S. sugar cartel is fighting the cartel here.
Yeah.
So, yeah, we have a lot of similarities, a lot of differences, but boy, this is such a beautiful place. And what you did here in Dream Body is probably the best I've seen in the world.
Well, thank you. That means we get to help more people. And I mean, you get to see it firsthand. I mean, the stem cells for neuropathy and these other things, I mean, they don't give you options for nerve pain. And they don't. Like we were saying, give you gabapentin, which pretty much never works, or something similar. And it's crazy.
Right, because the allopathic model, which has been around for about 150 years, it was predicated on treating the symptoms, and maybe perhaps that was okay back in the early 1900s. But today's a new world.
Yeah.
With stem cells, now with what you have done and some other people in your field, like Dr. Kaplan, Dr. Cook at Baylor, there are a lot of super scientists now looking at this. We know it works, we know it's effective, and we know it's safe.
Yeah.
Its question is, what are the doses? What are the best things we can treat with it? We know musculoskeletal problems, joints, elbows, hands, knees, peripheral neuropathy. I use it extensively. It works. Maybe some of the diseases like MS and autism, which we know it works, but probably dosing it needs to be looked at.
Yeah.
Applications. Now, we talked about intrathecal, meaning inside the spinal cord. Intranasal. Yes, that's another route of intramuscular. Now, you and I have something in common. We both had our L4-5 sciatica treated.
Yes, it's not fun.
Well, here we are, 2 chickens. Yes, I had sciatic for a year and a half. I had a little bit of foot drop. Finally said to my neurosurgeon friend, I said, why don't we do stem cells? Well, not enough research. This is in Scottsdale. I said, well, I use it all the time, so why don't we do that? He said, well, I can't do it. I said, I'll do it. So I went up. He was downstairs in my office in Scottsdale, so I went upstairs. I said, one of the other doctors, I'm going to mark the spot, and you inject me. I never did any injections before. I said, I'll guide you through it. It was not painful, and I'm not a hero on that sort of thing. It wasn't painful.
It's intramuscular.
It was intramuscular, an IM injection. I did not go inside the spine, although you can, but I wanted to see what an IM injection would do around S1, L4, 5, S1, and 2.
Yeah.
And I was back playing tennis in 3 days. That's why one of the reasons I'm down here, because it's a great little place that I'm staying at. Canton del Sol. Give a shout out to them for their tennis. Play with this kid today who's at the university. What a great kid.
Yeah.
And he's 21 years old, play with an old guy like me. And we had fun this morning. We played for an hour and I was panting. But I did play. And I had stem cells, and you had a similar experience.
I did, and look, it sounds like we both did the same thing. We both went too hard, too fast, too soon.
Yeah.
I tell patients, 2 weeks, nothing, 4 weeks, late rehab, but of course, you don't listen to your own advice. And
No.
I flew to Peru the day after treatment and did 2 weeks in the Sacred Valley carrying my 5-year-old son up ancient ruins. It was one of the toughest back workouts of my life. My sciatica was gone before the trip was over, within 10 days.
Exactly. Now, see, even that word sciatica, what does it really mean? Sciatic, around the sciatic sacroilium, it's the sciatic nerve, but it's really inflammation.
Yeah.
And stem cells, no matter what kind you use, and we both used umbilical tissue,
Correct.
Wharton's jelly. Did you know, I'm big into Wharton's jelly. Who first looked at that?
Wharton.
It was Wharton. I looked at that. It was a guy in England in the 1600s, and I was saying to myself, well, John Wharton, what were you thinking? What are you doing around there? But that's where it got its name. But it's the supportive tissue of the neurovascular bundle. And we were talking about your laboratory. How long can you take to harvest these tissues?
Yeah.
And in Mexico, it's the same as the United States. They're donated tissues. They're not sold.
No.
They're donated by a C-section.
Correct.
And tell the audience how you go through the looking at these cells, making sure that they're adequate and really effective for human use.
Yeah, so we want to make sure they're from the youngest, healthiest women. I mean, as you know, if you're over 30 and give birth, that's a geriatric birth. So it sounds crazy at 30, but that's what it is. So we want women that are between the ages of 18 and 25. We want to make sure that it's their first birth, because they're always going to be a bit healthier at that point, lower risk complications, and we want to make sure how many sexual partners, because a stem cell can't carry a virus, but it has a less than 5% chance of carrying a retrovirus if the donor had a retrovirus. So if they only had one sexual partner, we're it's a good way to limit the chance of having a retrovirus. So we look at all those things, and then we're actually filtering out too whether or not they've had the COVID vaccine. If they've had any COVID vaccines, we eliminate them too, because that's a big question that we get. And we check all the CD markers of the tissue. We check the health, blood work. I mean, I showed you the list. It's like a whole workup. We want to
Very comprehensive, yes.
just want to make sure that they're very healthy is kind of the point. So we get healthy cells.
Healthy cells make healthy people. So I really appreciate you taking the time with me on this visit, and we're going to be doing a lot more.
No, thank you.
Thank you.